Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. These questions are all about testicles. Question number 1. My testicles will sometimes leave the sac and go into the area above my actual penis. I can push them back down and push them up. Is that normal? So, yes, as far as your testicles lifting up on their own, that's actually a natural reflex that protects them from getting too cold. So your testicles house sperm, and sperm actually has a hard time surviving at our body temperatures, so it needs to be stored outside the body where it's slightly cooler. But when it's cold outside, this reflex pulls the testicles into the body so that they can stay warm and the sperm can stay healthy. The one thing I would say is that if you're actually able to push them into your body, that's more like the inguinal canal, which is where sometimes individuals get hernias. Don't panic, not a big deal. Everyone has this inguinal canal, but it sounds like yours might be a little bit larger. And so I would show a doctor the next time you go in, but it's not an emergency. If though you're just talking about the testicles being pulled up whenever you get cold or whenever you ejaculate, which we'll talk about in a minute, then I wouldn't worry about it. That's a normal reflex. Question number 2. Is it normal for one of my testicles to hang lower than the other? Yep. It is usually the left one, but sometimes it's the right one, so not a big deal. It's just because of the way we develop that one of them hangs a little bit lower. Question number 3. It seems like one of my testicles changes size, gets smaller, when I masturbate, but then it goes back to normal size. Is this anything to worry about? So, no. There are a couple of reasons why you might be experiencing this. So, first of all, whenever someone gets sexually aroused, blood flows to the genitals, whatever your gender. But for those with male body parts, that's kind of how an erection happens, is there's more blood flow down there. But the blood flow doesn't just go to the penis, it can also go to the testicles and to the scrotum. And so sometimes you might notice that the testicles and the scrotum get a little bit larger with sexual arousal, whether that's by yourself or with a partner. But when you ejaculate, blood then returns to the rest of the body. And so you may be noticing that things get a little bit bigger and the scrotum gets a little bit larger with extra blood flow, and then it goes back to normal. So that's one reason you might be thinking, oh, things are shrinking. The other thing to know is that when you ejaculate, it is common for testicles to actually be pulled up into the body, which is potentially effective in getting that sperm out. So that might also be what you're experiencing, is that the testicles are pulled into the body. So you may be thinking, oh, my testicles are shrinking, but they're not really. The one thing I would say is that if your testicles don't return to normal, or if you do notice regular steady changes in size, whether that's bigger or smaller, then you should see a doctor. But if it's just with masturbation or ejaculation and it's a temporary change, it's probably because of blood flow or being pulled into the body. Not a big deal. Question number 4. I had testicle discomfort in my right testicle about 6 months ago, and when I got it checked out, they found there was a cyst on my epididymis. Now I have a similar testicle discomfort on my left testicle, and I just want to check and see if that ultrasound I got 6 months ago would have picked up a cancerous tumor, or do you think that's what it is? So it's tough to say. You should know that cysts on the epididymis can happen, and it's great that you saw a doctor when that happened. Because they did an ultrasound, what they picked up on with the cyst was probably that it had fluid in it, and so that would be diagnostic for a cyst. Because you have one on the other side now, I would recommend seeing a doctor again. Don't panic, just to have it checked out, make sure everything looks good, okay? But this is a great opportunity to go over some anatomy. For those with male body parts, you should have 2 testicles within the scrotum, so 2 balls within the sac. On the back of each testicle is the epididymis, which is a long, thin tube where sperm is stored in preparation for ejaculation. On the top part of the epididymis, so the back upper side of each testicle, there's the spermatic cord, which is where there are bundles of blood vessels and the tube that sends sperm from your testicle and the epididymis up to your body. So you can feel that spermatic cord if you feel gently rub the skin of the scrotum between your fingers on the back upper side of each testicle. You should feel a little nodule, and that bump is okay. That is where your vessels and the tubes are supposed to be. But if you feel any funny bumps, like it seems you found, good job, or if you feel other bumps on the testicles, it's worth showing a doctor. Don't panic, there are other things that can cause little lumps or bumps, but that is kind of the rundown of where bumps should be on the back, upper, sometimes inner side of the testicle, and where they shouldn't be. Question number 5. My girlfriend and I are trying different things, and I'm kind of enjoying when she squeezes and tugs on my testicles, pulls my scrotum, and kicks or punches them. When I have a boner, pain actually feels good. Am I crazy? Are there any tips or advice you can suggest, or am I killing generations of children? Okay, so first of all, you are not crazy. Lots of people experience pleasure with testicular pain. The thing I would say is that as you are doing it right now, it doesn't sound like you're causing any major damage. But the testicles are important, again, because they house the sperm. And any damage to the testicle or to those structures that I just talked about on the back, upper side, whether that's the blood vessels or the tube that carries sperm from the testicle to the inside of the body, any damage to those things could cause permanent damage. So be cautious with your pain. It's okay, you're not crazy, but things to be aware of. Don't do any direct kicking or punching, especially really forceful. If you ever see any bruising, or if you experience severe pain that doesn't go away after 10 minutes or so, you should be seen by a doctor. Tugging, pulling, squeezing won't do a whole lot of damage, so you're pretty safe to do that. And that'll do it for this round of testicle questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.